Hello, everyone. We are back with another session with Carbon Health, bringing answers to your questions directly from physicians who have experience with these particular topics. And today I'm really excited to be joined by Dr. Amir Abdullah, who is a clinical manager at Carbon Health, and we'll be discussing a highly requested topic, which is all about shingles. So I'm going to turn it over to Dr. Abdullah to just give a description about what even is shingles.
So shingles is basically caused by the reactivation of the varicella zoster virus, which is also known as the virus that causes chickenpox. So when you're infected by the varicella virus as an infant, it's postulated that the cell-free virus present in vesicles that, characterize the chickenpox rash, they infect nerve endings in the skin and move along sensory neurons and lay dormant in a part of the neuron known as the dorsal root ganglia. So when reactivated for various different reasons, such as stress, immunosuppression, or waning of the immunity over time, the involved sensory ganglion will exhibit intense inflammation that eventually patients develop this classic maculopapular rash. Typically it's unilateral and it follows a single dermatome path of your skin. So basically a dermatome, if you think about it, your body's kind of divided into little bands, which are innervated by certain sensory neurons. And the rash will almost typically follow that one pathway that's innervated by that single nerve. Occasionally this is preceded by non-specific prodrome symptoms, so like headache, fever, malaise. You may start having the pain in that area before you even have the rash. So the rash can sometimes come 2 to 3 days after you have this pain, which patients describe like a sharp, burning, tingling, like numbing sort of pain. And it's pretty severe. And it can be debilitating for some people, for sure.
So if someone is kind of coming in with some of these symptoms, what are treatments that they could actually receive to alleviate some of this pain?
Treatments, depending on the window, usually if it's within 72 hours, we start antivirals. So acyclovir, famciclovir, or valacyclovir. If it's greater than 72 hours, usually the antivirals, they don't work as well. That being said, if you're still developing new vesicles, at that point, still recommended to go ahead and treat with antivirals to help kind of hasten the process to recovery. But the other aspect of it is the pain which patients complain about. Like I said, it can be debilitating. So typically use NSAIDs, so ibuprofen. Certain situations, opiate medications are acceptable, as well as prednisone kind of help suppress the inflammation that causes a lot of the pain.
So can shingles also lead to any other complications, say down the line for an individual?
The most common one I would say is postherpetic neuralgia. So basically inflammation that's associated with an acute zoster flare. What can happen is it causes fibrosis. So basically structural changes, kind of permanent damage, so to speak, in your neurons. Postherpetic neuralgia, that's the most common complication of herpes zoster, basically defined as pain in what we call the dermatomal distribution. So following that little band that's innervated by a sensory neuron, and it's sustained for at least 90 days after the rash. It can occur in approximately about 20% of patients with shingles, and most of these patients are over the age of 50. What it means is patients can have resolution of the rash, but they can continue to have this burning, shock-like pain, which can be very uncomfortable for people. This pain is basically caused by nerve damage as a result of the inflammatory response induced by the virus replicating itself within the nerve.
And I'm going to turn it over to a couple of questions that we got from the community. One was asking, if someone had shingles, can they actually pass that on to somebody else if their case is currently active?
If you have shingles, you're not going to be able to pass shingles on to somebody else. But what you can do is pass chickenpox on to somebody who's never been vaccinated against chickenpox or somebody who's never been exposed to chickenpox in the past. So say a young child who's never been vaccinated or never been exposed to chickenpox, they could potentially contract chickenpox from a person with active shingles.
And if somebody chooses to receive a vaccine against shingles, what would be the requirement for them in order to receive that dose?
In the US, we currently have the Shingrix vaccine. This was released in 2017. Prior to this, we had another vaccine, but it was a different type of vaccine. The requirements to getting vaccinated are basically all immunocompetent people people older than 50, and as well as some immunocompromised patients who are over the age of 19, such as, certain patients on chemotherapy, patients with certain cases of organ transplant recipients. They would benefit from getting vaccinated as well. Typically, we don't even check if you've been exposed to varicella in the past or if you even have varicella titers. Once you're over the age of 50, it's almost assumed that you have the virus and you're vaccinated for it.
So you mentioned this type of vaccine called Shingrix, and I'm just curious, is that tolerated for all types of individuals, or are there some types of people in the population who can't receive this type of vaccine?
There are some. So the Shingrix vaccine is generally very well tolerated. Of course, there are instances where the vaccine wouldn't be appropriate. Basically, anyone who's allergic to any of the components of the vaccine, that's key. And certain transplant recipients can have potential rejection of the graft due to an immune response. So that is still unclear. And of course, the major one is patients with a history of Guillain-Barré syndrome, which is a demyelinating disease, should also maybe won't benefit well from it, given the possible association between the virus and Guillain-Barré syndrome.
So with a few cases of limitations for this type of vaccine, are you aware of any new advancements that might be happening in the pharmaceutical industry to provide a broader range of coverage on new types of vaccines to the population?
I believe a couple of companies, I think Pfizer and Moderna, are both utilizing mRNA technology, similar to what was used for the COVID vaccine, to introduce a new shingles vaccine. Of course, nothing's ready yet and still a few years out at least, but even since I started medical school, the Shingrix vaccine honestly has been out since 2017. So things change all the time, and with the new advancements and new data, we can always get better results.
So you mentioned that one of the requirements for receiving the vaccine for the general population, unless you have some underlying conditions, is being over the age of 50. So can somebody who's under the age of 50 even get shingles in the first place?
So yes, patients under the age of 50 can get shingles. There are a lot of young adults who, I've seen in clinic, who will come in with the typical rash of shingles, because at the end of the day, it's just a reactivation of a virus that's sitting in your body, and it can happen at any age. And the presentations are very similar, and the treatment is similar as well.
And I'll kind of wrap up this with our final question. Somebody from the audience asked if they recently had shingles, can they receive the shingles vaccine? And then if so, how long should they wait?
So following a recent episode of zoster, it's still unclear as to when the optimal time to administer the vaccine is. Typically, we delay it for at least a year, as the herpes zoster does boost specific immunity against the varicella virus. It's a booster shot of its own in many ways. The CDC doesn't really recommend a specific timeline either, but they do ensure that you wait at least till complete resolution of the symptoms, and it's definitely something you should talk to your PC about as to when a good time to get the vaccine is. The main thing I would say is getting the Shingrix before you have an outbreak can save you from a lot of pain.
So that concludes all of our questions related to shingles that was submitted by the audience. So I want to thank Dr. Abdullah a lot for coming up here and answering these questions and being able to give his time. So be sure to check him out at Carbon Health if you're in the LA area, or if you're around any of the Carbon locations, be sure to go in for your primary care needs. And we'll be back again soon with another topic with questions presented from the community. So we will talk with everyone soon. Thank you. Bye.